Professor Rodney Adam, who's an infectious disease specialist from the Aga Khan University Hospital. I also have with me Professor Omu Anzala, who's Professor of Virology and Immunology, Kavi Institute of Clinical Research, University of Nairobi. We also have Dr. Paul Yonga, who's the infectious diseases travel medicine specialist. And we also have Dr. Mercy Mwangangi, who's the Chief Administrative Secretary, Ministry of Health. We have many of your questions which you've been sending through WhatsApp videos. We're also going to be looking at some that you've been sending to us at NTV Kenya. That's on Twitter. Remember, the hashtag to follow is the COVID-19 pandemic. You can tag me at Dennis Okari as well. Let's go to the next question here, and it's about dead bodies.
Can a dead person transmit coronavirus if the corpse is not properly?
Well, I'll let Professor Anzala go straight into this. Dead bodies. There's a concern that the government is restricting the number of people who can go to burials, but you're coming from different cultures. There are those who will have to handle the bodies before they bury them. So what do you think about this?
Actually, the advice is two ways. The reason why we are trying to discourage huge gatherings at funeral is the issue of social distancing. That is one. But number two also, we are also trying to discourage handling of the body excessively, because secretions from the respiratory tract will still carry virus for a while before the virus is actually disseminated as the body decays. So on those two counts, that is the reason. But for the healthcare workers, we are discouraging handling that body excessively. We are also actually trying to discourage postmortems until we get good guidelines as to how we are going to conduct those particular postmortems.
Dr. Yonga?
Yes, I fully agree with Professor Anzala. And of course, the other thing is, right now, as you're continuing to learn more about the virus, we still do not know a lot about the transmission dynamics of how this virus is transmitted. And so part of the precautions really would be to try and limit as much as possible contact with bodies of people that may have died from COVID-19. Of course, in addition to the social distancing mechanisms that have been put in place.
Well, Dr. Mercy, what I'm hearing here is just avoiding handling the bodies, excessively. But do dead bodies, can you get infected from dead bodies?
So, Dennis, so far the science tells us that the secretions and the virus is able to survive for up to a certain number of days, and we're still studying to know this. So, indeed, we need to observe caution when we're handling any dead bodies. If we look at what's happening in Italy and China, we've been able to discuss with them, and the Chinese were able to share with us the precautions that they took in terms of offering the last rites for some of their bodies. And they did observe even elements of, distancing and wearing protective gear while burying their dead. So indeed, right now, we are cautioning. Now is not the time to have that continuous, engagement. During the funerals, as CS Motai directed, we want less than 15 people in attendance. We want restrictions towards family members only, and we want to avoid that continuous, engagement with the bodies. Because right now we are learning, and it's a new virus. We're still drawing lessons.
Well, the next question is about sexually transmitted diseases.
Can corona be transmitted sexually? And what was its actual cause?
Well, not too sure that the gentleman was trying to disconnect electricity for some people there, but his question is very, very direct. I mean, there's this debate on you don't kiss, then you don't cough next to someone or sneeze. So it's about fluids, STDs. I'll start with Professor Rodney Adam. What do you think about this?
Well, first of all, usually with sexual activity, there is also exchange of secretions that includes kissing, which is likely to be a high-risk kind of contact. So whether it is strictly sexually transmitted, with Ebola, it turned out to be that it was. I don't know that we have any direct evidence here, but maybe Prof. Anzala can comment further.
You see, if we just look at holistically in terms of how sex is practiced, holistically, I would actually say that that this virus, because you are not observing social distancing, can be transmitted through that holistic sexual activity. So the whole issue is that stay away from people you totally don't know completely, because you don't know whether they are infected or not, because protection really has to start with yourself. Take good care of yourself and stay away from all these things, because you cannot isolate just one activity and say that this one, if I do, it will stop me from getting but all these others. Because let's look at how sexually activity is conducted holistically. We now know, and we didn't know, that Ebola would actually remain in semen for prolonged period of time. We never knew that. We now know. This is a completely new virus. We know we can get this virus in stool. We can also get this virus in urine to some extent. We can get it in throat secretions. It can also be found in blood. All these are fluids. So for me, holistically, at this point in time, unless there's additional information, a sexual activity, the way it is practiced, can transmit this particular virus.
So, Professor, are you saying for a viewer who's watching that even for, well, married couples, they should not holistically, they are putting it, engage in this just to avoid this transmission?
You see, for me, I'm looking at people you totally don't know. You see, when you are a married couple, you'll be staying in the same house. And we are telling people to stay at home. You'll be staying with your family, with your wife, and your children. But what we are talking about is the activity of being outside with people you're actually not familiar with, and then disobeying the rules of social distancing. That's what I'm alluding to.
I mean, Dr. Massey, from a government's perspective, is this something that you've perhaps discussed, and is this something that you'll try and educate the public? How does this connect? Because it's a really big concern for a lot of people.
Right, so what we're saying is social distance, and social distancing includes when you're at the workplace, you need to ensure that there's distances. Within offices, we actually have emphasized and given advisories that people should work from home. But then if you're distancing and you're within the home, it's important that Kenyans are aware that right now there's a case definition of our most suspected cases. Now, if you've not traveled to a country that's high burden, or you've not come back into the country, and that you've actually followed the government's instructions in terms of working at home, in social distancing, in washing your hands, in disinfecting surfaces, then indeed I believe as a couple living within a household, then yes, you can engage in that sexual activity. But what we are discouraging you to do, and I think this was emphasized today, the bars will be closed, the entertainment spots will be closed. Do not engage in any interactions that will make you come, close to someone who is not within your household. Remember, should we end up needing to contact trace people who've had contact with any positive cases, how you help us make it work, how you actually contribute is by staying within your household, and therefore, if anyone in your household is afflicted, we would be able to know this is the set of people that we are dealing with. So we are really discouraging people going outside of their families, outside of their households to engage in any sexual activities.
Well, we'll be coming back with more of your questions, including an answer. I'm really interested to hear what Dr. Yonga has to say. He's the youngest in the panel, how practical this really